My name is Maria Rowena Duran and I am the Registered Manager of Holistic Healthcare Bedford. As a Registered Manager, I am responsible for the day-to-day running of the office, recruitment definitely, new care packages and the supervisions, assessing, and spot checkings are included in the role. CQC interview is very important to all care providers because, as we all know, we cannot continue with our business without regulated by the Care Quality Commission. It is very important that every care provider will be regulated by the Care Quality Commission because otherwise we cannot continue our business. We cannot perform our duties, especially in the domiciliary or any healthcare setting. Definitely, the Care Quality Commission should be involved before or prior to starting a business. It took us 5 months of waiting since we lodged our application for the Care Quality Commission. They responded actually saying that there are some backlogs. That's the reason why it's taking longer. Since we submitted the application sometime in October, they responded once after New Year saying that, apologizing because there are backlogs. But after two months of waiting, they definitely answered, emailed, and saying that be ready for your interview. They only gave me a week of preparation, but in saying that the moment we already submitted our application, I started, I'm going to say the word studying or reviewing. The head office, they're very, very helpful. They're always there to guide you. They will go into practice. We did a lot of mock interview. They gave us resources of where to find all these questions. Because they've learned a lot from other franchisees. That's the reason why they have a knowledge of what will be the questions. And I pondered that a lot. It helped me a lot. Being interviewed by the Care Quality Commission inspector is really just like when you were studying in the university, you had your NMC or thesis or whatever qualifications you need. It's the same thing. Can't stop thinking that, am I answering the right questions? But thankfully enough, like I said, thankfully enough that Holistic Healthcare Cambridge, our main office, are always there to help. Points to review or points to ponder. The inspectors or the Care Quality Commission inspector will go into ask about your policies and procedures. Definitely. The location that you have, because they actually, or the inspector explained to me that they need to ask about the office because there are a lot who are just having the virtual office and then they won't accept it because she explained that they need to know that you need to have a proper office because they will go in to inspect. In saying that the office has to be a proper office, Care Quality Commission, the website itself is really a big help because apart from your experience being a healthcare worker, the answers are also in the website of the Care Quality Commission. There were no unexpected questions. All the questions were relevant to all what you are doing, your daily tasks, the policies and procedure of your company, the regulations. That's very important. The regulations, everything is actually in the CQC website, and the office will going to help you about all those things. When they ask about the 5 key points, she started with safe. How safe is your company or your company will going to handle the services in the community. Of course, we need to expand your answer based on how we do it in the community, how we deal with the service user, how we perform as a manager, how you handle your staff. How effective is your service? She will ask, or the inspector will going to ask all the resources about effectiveness. How you going to answer? It's your everyday, day-to-day activity actually in the community, and all the tasks that you are doing will lead you to the right answer. I did a lot of memorization, studying, sleepless nights of thinking like, will there be more questions apart from safeguarding? Yes. they are very particular. They are very, very particular and specific about safeguarding. As long as you have your policies and procedure in place, and as long as you are following those policies and procedure, I don't think there will be a problem with that. And as long as the staff knows where to find the policies and procedure, that will be a big help. The policies for safeguarding, policies for the premises of the service user, premises and equipment, policy and procedure about health and safety, policies and procedure regarding mental act, policies and procedure regarding foods and fluid, all those things. She actually mentioned her own personal experience about dementia. The inspector asked, how are you going to deal with a dementia who is just starting, that you don't know that the service user is already having a dementia because it's not assessed, it's not in the care plan yet. During helping the service user, you are already observing that there is a possibility of dementia. She asked, what will you going to do? And I said, definitely the monitoring of the observations has to be reported and recorded. We reported that to the GP as well, because might be the service user needs to be reviewed, or the medications, and of course we need to involve the family as well. It is very important to have the records or the audits, as we are saying it, because Care Quality Commission is very particular with that. They need all the evidences, even if you keep on saying we have policies and procedure, we are doing this, we are doing that, but they need the evidence. It has to be, it's either papers, or if you don't have if you have the data yet, but for us, for the holistic, we have electronically records like this, so it's easy for the staff to just log in and record all those things that they have observed. Yeah, I've been working in the community for years, but this is my very first time to be interviewed by the Care Quality Commission. So expect the unexpected the feelings. I keep on telling to the inspector that the butterflies are all in here, and it's not scary because they will not going to scare you anyway, but it is really heart-pounding. My advice, probably as per experience, be ready. You need to review. This is what the CEO and all the directors are saying. Know your policy and procedures by heart. Yeah, because once you have the CQC, the head office, of course, you have your own already. You will be dealing with that. So you need to have or to know your policy and process and procedures by heart, not by word, but at least you know what the contents are. I'm going to be honest. I practiced. I went in front of the mirror, and I had the questionnaires that Miss Vian gave me, and I practiced myself. And those were the first few days, and then after that I was recording myself already in case, so I know how will it turn up, just in case. But it's different. It's different. You are practicing, yes, but in front of the inspector is different already. There is no right and wrong, because they are just gauging or testing your ability or your capabilities. They will actually, going to say that if you don't know the answer, that's fine, but we will going to explain to you what the answer is. So don't it's okay. Don't be rattled or scared if you don't know.
Alright, so how important is the body language and communication style during the interview? Is it important?
Very important. Body.
Can you explain why?
Gestures, like the rolling of the eyeballs, they actually are looking at you. They know that if you are looking for something else, or if you are reading something, they know. They can see you. They're very good in that. So body language is very, very important. I am going to make it a little bit more serious.
What do you mean?
Yeah, because I'm going to start learning about all these things earlier to avoid cramming. I remember Joseph Ason advised me yesterday that don't review anymore because there will be nothing to be absorbed, which is true. I tried like last minute preparation or memorizing, it didn't help. So better start early. If you will going to review, better start early. And while waiting, know your policies and procedure.
Amazing. All right. So final thoughts there. So what was your biggest takeaway from the entire experience?
Of the interview,
Yeah. What's the biggest takeaway?
the biggest. Well, I think I am going to share this. There was a question regarding deprivation of liberty. I know by heart what is depriving of liberty is, but all of a sudden, I forgot. The presence of mind, it has to be the presence of mind. Like, oh, I forgot the answer, but I cannot tell her that, oh, I forgot the answer. So I had to share an experience that answered her question.
So that's your biggest takeaway.
Yes, because instead of depriving liberty, what I answered is like a piece of cake. My service user would like to eat a piece of cake.
You're talking about joy here.
Yes, a piece of cake. So is it relevant to the question or not?
All right. So this is the last question. Any final words of encouragement for others going through this process?
It's not easy. It's not easy. I'm telling you, it's not easy. I've been a healthcare worker, a manager for how many years? But if you have the perseverance and if you know that you can do it, then go for it. Yeah, it's not easy, but go for it. If your heart is saying, this is for me and this is mine, and then go for it. Holistic Healthcare Cambridge is always there to help us. I am going to tell you again that I am very, very thankful that we have the main office, Holistic Healthcare Cambridge, because all the way they've been very helpful and they always inspire you. I really would like, sincerely, I really would like to thank, of course, I'm a believer. I'm really, really thankful. And I'm very thankful for all the management of Holistic Healthcare Cambridge. Thank you from the CEO, the two nominated individual persons, from the staff. Thank you very much. Of course, Birch, thank you very much. You are all very, very helpful. The plan is, of course, to manage the business now. I am thankful that after all those months of waiting, here we go. We have the CQC now, so focus to the right path.